Okay, my name is Makella. We're going to be doing our CPR task. Now, with this one, we're going to use a simulation dog just because of the circumstance. So, the first thing we're going to do, you would want to do is check for a pulse. There are two different ways. You can use your hand in a C motion and go under the chest and feel for a pulse there. Or you can use the back leg and use two fingers. I like to use either my first and second finger with my thumb on the top, just like this. So if no pulse is detected, if you have a larger breed dog, we'll do both. So if you have a larger dog, what you're going to want to do is use one hand and just have it like this, straight with your fingers straight out. And you want to put your other hand with your fingers interlocking right over the center of the chest, right behind their elbow. And you'll want to do 30 firm compressions at 120 compressions per minute. A good way to do that is with the song Staying Alive. And you'll want to do these, like I said, really firm. So 1, 2, 3. Oh, sorry. And then when you're doing those, stand on my tippy toes a little bit. I forgot. You're going to want to make sure that your elbows are locked and your shoulders are over your hands. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3. Okay. And so then what we would do is we would give 2 rescue breaths. So you put your hands kind of like this in a C motion over the bottom of the jaw and over the snoot, and you're going to hold them together and do 2 breaths right in the nose, and then you'll want to continue with chest compressions just like we did, again with your elbows locked and your shoulders right over your hands, so just like this, and doing those firm compressions. If you have a smaller breed dog, what you'll want to do is you'll want to take your hand in a C cup motion after you've already checked for a pulse, and do like this and grab either side of the chest and go 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Which is the same thing with those firm compressions, 30 of them, 30 compressions at about 120 compressions per minute, and you'll want to check for a pulse again to see if we've had a pulse start back up again with the back leg or the chest, and you'll want to continue to do this until your veterinarian has advised you to stop. The other thing that the vet might tell you to do is administer a trach tube, an endotracheal tube, so you would want to appropriately size and then sit them up to get the tube in unless the vet wants them on their side. And what you do in that situation is you have your assistant, or you can, if you needed to do it by yourself in an emergency situation, use your index finger and your thumb and go right behind the canines to hold the head up, and then you'll want to grab, and again it's easier if you have a restrainer. If you're administering the trach tube, you will want to get your tube, pull the tongue down all the way in front of the chin so that way you can see the epiglottis, and then I like to use my tube to kind of push our epiglottis down if it's covering our airway, and you just insert the tube right there, and that's how you would insert the tube and then hook it up to oxygen like that. But again, that is all up to the discretion of your veterinarian.